Asthma is a chronic respiratory condition that affects the airways in the lungs, making it difficult to breathe. It is a widespread condition, affecting millions of people worldwide, including children and adults. While asthma can range from mild to severe, it is a lifelong condition that requires careful management to maintain a good quality of life and prevent complications. What is asthma? Asthma is characterized by inflammation and narrowing of the airways, which are the tubes that carry air to and from the lungs. In people with asthma, the airways are often sensitive and overreact to various triggers, causing episodes of wheezing, shortness of breath, chest tightness, and coughing. These episodes are commonly referred to as asthma attacks or exacerbations. During an asthma attack, the muscles surrounding the airways tighten, bronchospasm, the lining of the airways becomes swollen and inflamed, and the production of mucus increases. These changes obstruct the flow of air, making it harder for the individual to breathe. Causes and risk factors. The exact cause of asthma is not fully understood, but it is believed to result from a combination of genetic and environmental factors. Certain risk factors increase the likelihood of developing asthma, including genetics. A family history of asthma or other allergic conditions such as eczema or hay fever increases the risk. Allergies. Allergic reactions to substances like pollen, mold, pet dander, or dust mites can trigger asthma symptoms. Environmental factors. Exposure to air pollution, cigarette smoke, or occupational irritants such as chemicals or dust may contribute to asthma development. Infections. Respiratory infections, especially in childhood, can damage lung function and increase asthma risk. Obesity. Overweight or obese individuals are more likely to develop asthma due to increased inflammation and pressure on the lungs. Symptoms of asthma. Asthma symptoms can vary from person to person and may be intermittent or persistent. Common symptoms include wheezing, a whistling sound when breathing, particularly during exhalation. Shortness of breath, difficulty catching one's breath or feeling out of breath, even during mild physical activity. Chest tightness, a feeling of pressure or constriction in the chest. Coughing, persistent coughing, often worse at night or early in the morning. Fatigue, reduced oxygen levels during asthma attacks can cause tiredness. These symptoms may worsen with exposure to triggers, including allergens, exercise, cold air, stress, or respiratory infections. Types of asthma. Asthma is categorized into several types based on the triggers and severity. Allergic asthma, triggered by allergens such as pollen, dust mites, or mold. Non-allergic asthma, triggered by factors like stress, exercise, cold air, or respiratory infections. Exercise-induced asthma, EIA symptoms occur during or after physical activity. Occupational asthma, caused by exposure to irritants in the workplace, such as chemicals or fumes. Severe asthma, a rare form of asthma that does not respond well to standard treatments. Diagnosis. Asthma diagnosis involves a thorough medical history, physical examination, and lung function tests. Key diagnostic tools include spirometry, measures lung function by assessing the amount and speed of air exhaled. Peak flow meter, a handheld device to monitor breathing patterns and detect airway narrowing. Allergy testing, identifies allergens that may trigger symptoms. Methacholine challenge test, checks airway sensitivity by using a substance that narrows airways in asthmatics. Treatment and management. While there is no cure for asthma, effective treatment can control symptoms and improve quality of life. Asthma management typically involves a combination of medication, lifestyle adjustments, and trigger avoidance. Medications. Quick relief inhalers, bronchodilators provide immediate relief during an asthma attack by relaxing airway muscles, example albuterol. Long-term control medications, reduce inflammation and prevent symptoms over time, example corticosteroids, leukotriene modifiers. Biologics, advanced therapies for severe asthma targeting specific pathways in the immune system. Lifestyle adjustments. Avoid triggers such as allergens, smoke, or air pollution. Maintain a healthy weight to reduce pressure on the lungs. Exercise regularly to strengthen respiratory muscles, with proper precautions. Asthma Action Plan. Patients should work with their healthcare provider to create an individualized action plan outlining steps to manage symptoms, prevent attacks, and handle emergencies. Complications. If left untreated or poorly managed, asthma can lead to complications such as frequent hospitalizations due to severe attacks, reduced lung function over time, anxiety and depression from living with chronic symptoms. In rare cases, life-threatening respiratory failure. Living with asthma. With proper management, most people with asthma can lead active and fulfilling lives. Education, regular medical follow-ups, and adherence to treatment plans are essential for controlling the condition. Increased awareness about asthma and advancements in treatment options continue to improve outcomes for patients worldwide. Asthma, while a chronic disease, is not insurmountable. With the right approach, individuals can minimize its impact on daily life and breathe more freely.